I'm Diane Steiner. I'm Deputy Director of Public Health at Norfolk County Council. Our figures in the last 4 years, on average, have been coming down from a peak in 2014. The numbers do kind of go up and down a bit. We hope it's a sign of a good downward trend. Our rates are still a bit higher, though, than the national average. And the national average is also going down, thankfully. So we're trying to catch up and make a bit of progress in that regard. But the numbers are coming down, so that's a good sign. Definitely there's higher risk in middle-aged men. We also have suicides across the age range, of course. But with men and in middle age, it seems to be a particular area of concern for us. Since it was launched late in 2016, we've managed to hit a number of our milestones. So one of the key ones was to set up a specific website branded I Am Really Not Okay, with the theme of reading between the lines. And we managed to get some resources on there. So for example, Staying Safe Planner, a safety planning tool, other kinds of guidance. And it's aimed both at people who are at risk of suicide, but also friends, carers, and families, and also professionals. So there's different sections for different needs. I think what we all acknowledge is that suicide is everyone's business. No one agency, no one individual can do it alone. We need the help of different organizations, whether they're in the public sector, the private sector, the voluntary sector. We need individuals, we need families and communities and friends to all get involved, because it won't happen without all of these organizations and individuals working together and sharing what they know and learning from each other.
I think it's particularly important when it comes to suicide. I mean, firstly, to acknowledge that suicide is a problem. As I'm sure most people will be aware, it's the commonest reason for a man to die between the ages of 15 and 50, and it's the commonest reason for a lady to die between the ages of 15 and 35. I mean, that in itself is a reason to have the event. One of the problems with suicide prevention is you can't just point the finger at any one agency or one organisation and say the problem is the Mental Health Trust, or the problem is GPs, or the problem is the police, because it just doesn't work like that. So I think it's even more important to have a conference to deal with something like suicide, where the problem is actually, or the solution rather, is actually from many, many organisations to work together. We can all suffer with mental health or mental illness. That's the first thing, because me being a bloke and a doctor, I literally thought that I was bulletproof. I didn't think that it was ever going to happen to me. I'd never had any mental health problems for the whole of my life, and then, how old was I? I think it was about 51 or 52. Suddenly I became very poorly, became depressed, and became suicidal. So I think that probably the first thing to do is to say, actually acknowledge that however fit and healthy you feel, it is something that can happen. You can become mentally ill. That's the first thing. If you do become mentally ill, then I suppose don't let everything unravel and the wheels come off the bus. I think you need to actually step in earlier. What I would urge is that in the same way that if you have a hip problem or a knee problem or a chest problem, you go to the doctor and basically acknowledge that there's an issue, and then hopefully they try and sort it for you. If you do the same thing with mental health, by and large it will help. So I would just say, firstly acknowledge there's a problem, and when you have acknowledged there's a problem, go and get some help. And then we can hopefully avert a crisis. I wasn't very good at it when I did it myself, but I've learned since, okay?